Australia's birth rate falling to historic lows and fertility rates plummeting. Today, health experts are pushing for a national overhaul of the fertility industry, releasing new recommendations to make parenthood a possibility for more would-be mums and dads.
You can't put a price on parenthood, but that's the reality for many Australian parents.
The process of IVF cost me $50,000.
Single and low on eggs, Samantha Frazinski found the reproductive regulatory environment less than fertile.
Despite me being diagnosed as infertile, I had to undergo 2 IUI procedures, regardless, to prove that I was infertile to qualify for funded IVF.
Conceiving on her second round of IVF, she considers herself one of the lucky ones.
Piano.
But with the birth rate dropping by over half since the 60s, national fertility experts are pushing for industry reforms to make conception more conceivable.
Ultimately, this is about improving access for more parents to have more healthy babies who might otherwise not be able to do that.
Australia has more than 300,000 babies born through IVF, and 20,000 more are added each year.
Fertility rates are declining. We need to consider the options for the next 10 years, and also we need to increase access and reduce cost.
Experts are calling for a 10-year plan to regulate the IVF industry, combining 40 pieces of state and territory regulation into one national family-friendly framework.
27 million people don't need 40 different pieces of legislation.
A national fertility plan would expand the definition of infertility to allow same-sex couples and single people access to Medicare's subsidised IVF, provide a subsidy for low-income earners, set up a national bank for egg and sperm donation to address the shortage, and a single donor registry to protect against enthusiastic contributors flooding the system.
This will probably be 42 or 43.
That's a lot of kids, man.
The donor drought leaving many potential parents desperately seeking sperm online, increasing the risk of the offspring unknowingly having a baby with their siblings later in life.
Especially on Facebook, there's groups available that you can join. For me, I had a fear if I got sperm online, my child might end up with a heap of siblings.
So with more Aussies than ever turning to fertility treatment to start a family, is it time the baby business got ahead of the boom?
Dr Tamara Hunter is a fertility and IVF specialist. Thanks so much for coming on, Tamara. And look, it's such a sensitive subject, and there'll be people watching this who are going through it right now, want to go through it, and it can be all-consuming, can't it? What is the number one thing that you think needs to be in this national fertility plan?
Yeah, so we're really excited about this because, well, I certainly think, and many of my colleagues believe, that harmonisation is absolutely required. Fertility or infertility usage rates is going up, as you mentioned, some 18,000 children born every year, and that's only going to increase as couples and people get older trying to have families, and also people are now accessing IVF to avoid genetic diseases passed on to their children. So it's really important that we start to harmonise the guidelines and the laws around how we manage our patients. Just think about donors, for example. In Western Australia, they are limited to 5 families only, whereas in Victoria, they are limited to 10 families. So there are lots of pieces of legislation that have to be navigated right now that make it really difficult and costly for patients and providers.
We just heard in that story that there are families that are so desperate they're turning to social media for sperm and even egg donors because of that cost and availability. Talk us through how risky that can be.
Yeah, look, that's something that we really do worry about. The first thing is the health impact. So the transmission of sexually transmitted infections and infections that people might not be aware of that are actually going to cause problems with the children born. So things like sensorineural hearing loss, blindness, and also intellectual disability. There's that sense of exploitation. You know, this is a very vulnerable, desperate and emotional group of people accessing a donation. And so are we exploiting those people? And then I think the third thing to really consider is the possibility of multiple donor SIBs and what that means for the health and well-being of the future children.
One of the reasons that the number of IVF babies is increasing is that people are having to or choosing to wait longer in life to start families. And so there's a lot of conflicting information online about this. When is the right time, or when should someone start to pursue fertility treatment?
Yeah, well, I actually think we should be talking about reproduction and fertility in the same breath as we talk about contraception, because so many people out there just don't know how difficult it is to conceive as we get older. When you're 36 years of age, you've got half the chance of conceiving than you did at 20. By the time you're 41, your chance of having a baby is about 4%. So we really need to be teaching our young people, and the right time is probably actually in our mid-20s, because it's not just about that first baby that you're going to have, but it's perhaps about the second and the third, and you might want to family space them. And then all of a sudden, you're getting into your late 30s and early 40s before you're thinking about actually building that family further, and that's where our problem really lies.
Thanks so much for coming on, Dr Tamara Hunter there. Thank you.
My pleasure.